Jamaica has recorded its first case of monkeypox, but the health authorities say they do not anticipate any risk to the population. Health Minister Dr. Christopher Tufton made the announcement at a press conference on Wednesday.
The patient is a male who recently traveled from the United Kingdom. He presented to the public health system on July 5th, having arrived on the island some 5 days earlier. The patient has been isolated, having confirmatory tests done, and his close contacts quarantined following contact tracing.
He says the confirmation of the first case of monkeypox has triggered the ministry's emergency protocols.
Among other things, our Emergency Operations Center has been activated. A review of all isolation facilities is to be done to look at the capacity to manage both monkeypox and COVID-19. The necessary health protocols, including surveillance, clinical management, lab management, as well as infection prevention and control, are being completed for the distribution to health teams island-wide.
Monkeypox is a disease that can make you sick, including a rash which may look like pimples or blisters, often with an earlier flu-like illness. Monkeypox can spread to anyone through close, personal, often skin-to-skin contact. Chief Medical Officer Dr. Jacqueline Mackenzie says Jamaicans should be aware of the symptoms and isolate once they see the signs on their person.
For example, travelers that are coming in, persons would, if they would develop any kind of symptoms, any kind of rash, then you should seek help. You should stay home for the first part, isolate yourself, and you should inform your medical practitioner that you're coming to visit so that the necessary precautions can be taken. And protect yourself, of course, when you go out from the risk of, protect others, I should say, from the risk of getting the disease by covering any kind of rash that you have. And of course, wearing a mask. The fact is that if you are carrying out the COVID precautions in terms of wearing the mask, keeping your physical distancing, then you will prevent the spread of monkeypox as well.
Dr. Tufton says given the nature of the virus, there is no need for alarm.
I do not envision the kind of response to the novel coronavirus when it came on in March 10th, 2020. I believe that we can manage this current threat, and if we play our part, we can manage it in a way where we can continue to live our normal existence.
The health minister is urging Jamaicans to play their part to ensure that the virus is contained. Meantime, Chief Medical Officer Dr. Jacqueline Mackenzie is warning partygoers to observe the well-established protocols to reduce the likelihood of transmitting infectious diseases such as COVID-19 and monkeypox.
In every situation now, it should be part of the new norm that you avoid close contact in order to prevent spread. I mean, we are in a pandemic. And so therefore, we should therefore be avoiding close contact to prevent spread of COVID-19, because we just do not know when a new strain that is going to be a more severe strain will develop. So for everybody who is planning to go out there and party, I should hope that they would bear this in mind, that close contact is still something that is to be avoided, and to use your precautions, the wearing of your mask, the hand sanitizing, hand washing frequently to prevent contact. But I would also say to persons, another message that should have been clear across the COVID-19 pandemic is to stay home if you are sick.
The CMO explained there are some differences in the transmission of monkeypox from what they're used to.
For example, monkeypox is known to be mostly an animal-to-human transmission, and we're seeing more human-to-human transmission now with these cases that we're seeing across the world. So there are some changes, but these are still being investigated. What we do know is that monkeypox is not easily transmitted and requires close contact and close prolonged contact for transmission to occur. So the other thing is that you have the visual unlike COVID, you actually see the rash, although we are having some cases now that are a little bit atypical in their presentation, but you do have that visual effect.